Welcome to the Neurostimulation podcast. I'm Michael Passmore, Clinical Associate Professor in the Department of Psychiatry at the University of British Columbia in Vancouver, Canada. The Neurostimulation podcast is intended to bring cutting-edge neuroscience and clinical neurostimulation information to you free of charge. Every week, we're going to explore various topics in this exciting field, all the way from the basics of clinical neurostimulation, various different research breakthroughs in neuroscience and neurostimulation, all the way through to how those research breakthroughs are being translated into real-world treatments that can help to improve health and wellness. So whether you're a researcher, a clinician, a student, or simply someone who's interested in how our brains work and what we can do to help them to work better, this podcast is for you. Today, I'm very excited to present the introductory lecture in a free course on transcranial direct current stimulation that I'm going to be offering here. For a number of weeks, we're going to be exploring transcranial direct current stimulation, all the way from the basics of the electrophysiology through to clinical applications in terms of how it's being used to help people in terms of symptom management and functional optimization these days, as well as future considerations in terms of where this technology may eventually go in terms of helping optimize health and wellness. As usual, I'd like to emphasize that this podcast is separate from my clinical and academic roles and is part of my effort to bring neuroscience education to the general public free of charge. Accordingly, the content that I'm presenting here is intended for educational purposes only and not as medical advice. If you have any specific questions about your particular healthcare matters, I would encourage you to discuss those with your own qualified healthcare professional. By watching or listening to this podcast, you acknowledge and agree that any decisions related to your own health are your responsibility and should be undertaken in consultation with your health professional. This episode is presented by ZipStim Neurostimulation. ZipStim is the neurostimulation clinic that I own and operate. If you want more information about the programs that we have to offer, please check us out at zipstim.com. That's zipstim.com. Now let's get started with the introductory lecture and the course in general. The course I'm going to offer here is rooted in foundational concepts and applications outlined in the textbook titled Practical Guide to Transcranial Direct Current Stimulation, Principles, Procedures, and Applications, edited by Helena Notkova, Michael Nitsche, Maram Bixen, and Adam Woods. This book provides an unparalleled overview of transcranial direct current stimulation, from biophysical principles all the way through to clinical applications, and it'll serve as our primary reference throughout this course. If you're interested, I would really encourage you to consider buying a copy of the textbook or taking a copy out from the library and having a look. It's a really useful resource for understanding transcranial direct current stimulation, all the way from the basic science through to clinical applications and future directions for research and clinical use. Today, I'd like to establish a foundation by exploring neurostimulation in general, situating transcranial direct current stimulation within the broader landscape of brain stimulation techniques, and examining the unique characteristics of tDCS. These introductory concepts will provide the groundwork for deeper dives into the science, the protocols, the applications, and methodologies that we're going to be discussing in subsequent lectures. So by the end of today's lecture, participants will be able to first define neurostimulation or neuromodulation and describe its role in neuroscience and in clinical practice. Participants will be able to explain how tDCS, transcranial direct current stimulation, how it fits within the broader landscape of neuromodulation or neurostimulation techniques. And participants will be able to identify the unique features, advantages, and limitations of tDCS compared to other commonly applied neurostimulation technologies in clinical practice. So the purpose of the course in general is going to be to provide you with foundational knowledge for clinical applications as well as research use of tDCS. As a clinician myself, my expertise and interest is mainly in clinical applications of neurostimulation technologies, although obviously that draws from research findings, and so there is a healthy relationship between the two fields. But my expertise really will be on the clinical side, and a healthy discussion, though, I would encourage in the comment section from researchers and clinicians who might in turn be able to help one another answer questions that I might not be able to. So the other thing I'm hoping is that with this course, we can start to build a healthy community of people who are also interested in clinical applications of neurostimulation, as well as research into these fields, but also for the general population who are interested in finding out more about these issues. The course is also intended to explore practical applications of tDCS in particular, but neurostimulation in general for treatment of mental health problems, chronic pain issues, as well as other things that are potentially going to become more clinically available as the evidence builds, such as cognitive enhancement. So why neuromodulation or neurostimulation? You'll see these two terms, they tend to be somewhat interchangeable in the literature. And in some ways, neuromodulation is probably a better term because the modulation piece, which refers to changes, is also recognizing that with these technologies, there does not necessarily always have to be a stimulating effect in terms of positively changing brain circuitry or physiology to be somehow accelerated or stimulated. That the technology sometimes does the opposite, slowing or reducing the rate of electrical neurotransmitter functioning and activity in the brain. So it's not necessarily a matter of just stimulating or augmenting the electrical neurochemical activity, but it can be a combination of stimulating or slowing. And so the modulation term is technically more appropriate, although for the purpose of this course, I'll probably mostly be using the term neurostimulation just for consistency's sake to avoid confusion. But just recognize that those two terms are pretty much interchangeable. So what is neurostimulation or neuromodulation? Well, I think a reasonable broad definition could be that it refers to the targeted regulation of nervous system activity using electrical, magnetic, or even chemical stimulation. Now, if we include the chemical stimulation piece into that, then that really broadens the scope of the definition to include medication. So for the purpose of this course, I think mainly we're going to be concentrating on the use of electrical or magnetic stimulation as opposed to chemical stimulation. However, as an aside, I would say that an interesting side piece or side consideration in the entire space of neurostimulation has to do with combination approaches, right? So using clinical neurostimulation techniques in addition to other more contemporary or legacy treatment options like medication and or psychotherapy. The second piece here in terms of defining neurostimulation are breaking it down into categories. And I think that the two most straightforward categories basically look at whether a neurostimulation technology is invasive. In other words, does it involve the need for some kind of a surgical procedure in order to implant hardware into the body? And so currently the two main areas that involve that type of technology are deep brain stimulation or DBS, spinal cord stimulation, vagal nerve stimulation is another one that we're not going to talk about, but it's important to know about it. And so the invasive neurostimulation techniques versus the non-invasive neurostimulation or neuromodulation techniques. So the non-invasive techniques are techniques like electroconvulsive therapy, transcranial direct current stimulation, transcranial magnetic stimulation, and transcutaneous electrical nerve stimulation. So these are things like for example, the latter, TENS, if any of you have had any kind of an injury, like a musculoskeletal injury, and you've had to go for physiotherapy, you may have had a TENS machine applied to your muscles just to try and, as part of your physio, your rehab, to help your musculoskeletal system to recover from the injury. So it's an external application of electrical current, or in the case of transcranial magnetic stimulation, the external application of a magnetic field that in turn stimulates an electrical current in the underlying neurological tissue. So again, for the purpose of this course, it's going to be focused on transcranial direct current stimulation or tDCS, which is a subset of the non-invasive neurostimulation technologies that are available and applied for clinical benefits. Some examples of clinical applications for these various neurostimulation techniques include chronic pain, and for tDCS in particular, the chronic pain conditions that are mainly targeted with this technology are fibromyalgia and migraine headaches. There are also mental health issues that can be alleviated with these technologies, such as depression, which has been treated with neurostimulation techniques for decades, really, including electroconvulsive therapy, and more recently, repetitive transcranial magnetic stimulation. But other mental health problems like anxiety disorders, Parkinson's disease, not mental health per se, but neuropsychiatric. And then we'll also talk a bit about some other broader application potentials like things like stroke rehabilitation and cognitive enhancement in general. So let's go into an introduction into tDCS. What is tDCS? Transcranial direct current stimulation. So this is a non-invasive brain stimulation technique that delivers a low, constant electrical current to targeted brain areas via surface electrodes that are placed on the scalp. The historical development of tDCS is quite interesting. The idea of using electricity to influence the human body has ancient roots. Observations as far back as 43 to 48 AD noted that applying electrical discharges from live torpedo fish to the scalp provided pain relief for headaches. By the 11th century, Ibn Sida, that's IBN-SIDAH, proposed that electrical stimulation of the frontal bone could be used as a treatment for epilepsy. In the 18th century, Luigi Galvani and Alessandro Volta significantly advanced the field with their foundational experiments in bioelectricity. Galvani's voltaic cell experiments highlighted the role of electricity in physiology, establishing an early scientific basis for electrical therapy. Giovanni Aldini, a nephew of Galvini, extended this work into mental health, using galvanism to treat melancholia, an old term for depression, and other conditions. Aldini's efforts were among the first to demonstrate the therapeutic potential of transcranial stimulation. The 19th century saw electrical stimulation for neurological and psychiatric disorders. However, many studies lacked scientific rigor, often failing to detail stimulation parameters or accurate diagnoses. Despite this, notable physicians like Dr. Alexander Robertson highlighted the therapeutic potential of electricity when applied carefully and systematically. In the 20th century, technological advancements enabled the development of more sophisticated devices. Techniques such as cranial electrotherapy stimulation, or CES, and electroanesthesia, or EA, emerged. Although promising, these methods often involved high current intensities and faced challenges with side effects and safety concerns. Electroconvulsive therapy, or ECT, was initially introduced in the 1930s. This marked a pivotal moment in the history of neurostimulation. ECT involves the application of high-intensity electrical currents directly to the scalp in order to induce generalized seizures. Unlike earlier methods of electrical stimulation, ECT had a clear therapeutic intent and proved effective for severe psychiatric disorders, particularly major depressive disorder with psychotic symptoms and/or catatonia. While ECT's precise mechanism remains partly unknown, it is thought to influence neurotransmitter systems, neuroplasticity, and neuronal connectivity in key brain regions, such as the prefrontal cortex and limbic structures. What are the advantages and limitations of ECT? While ECT remains one of the most effective treatments for severe, treatment-resistant depression, particularly with psychotic features or catatonia, it requires staff and equipment that's typically only available in a hospital or medical clinic setting. It requires a brief general anesthetic during the application of the electrical stimulus, and there can be concerning side effects such as transient confusion or memory impairment that's bothersome, although usually temporary. There is also the stigma related to the history of electroconvulsive therapy, having been overly applied in a less refined way in decades before the machines were more engineered to find the best balance between effectiveness and minimizing side effects, such as those that are in practice today, as well as clinical guidelines and therapeutic treatment algorithms that are designed to optimize outcomes while minimizing side effects. It's important to include ECT in the historical discussion of neurostimulation. Not only is it still very important and effective for treatment of severe psychiatric illnesses, such as severe major depressive disorder with psychotic symptoms or catatonia, but it set the stage for more recent advancements in neurostimulation, such as transcranial magnetic stimulation and transcranial direct current stimulation. Both of these aim to achieve therapeutic effects in conditions like depression and chronic pain and perhaps cognitive enhancement without requiring the induction of seizures or requiring anesthesia. In the early 2000s, advancements in neuroscience and technology led to the resurgence of interest in non-invasive neurostimulation techniques. Researchers were able to demonstrate that weak direct currents applied to the scalp could safely and effectively modulate the underlying neuronal excitability. Unlike ECT, tDCS operates at a much lower current, intensities of around 1 to 2 milliamperes, and does not induce seizures or require any kind of anesthesia or patient sedation. The non-invasive nature of tDCS, combined with its low cost and minimal side effects, makes it a much more accessible option for patients and researchers. While ECT remains the gold standard for severe psychiatric disorders such as severe depression with psychotic features or catatonia, tDCS is increasingly being recognized as an option for milder conditions or as an adjunctive option to medications or psychotherapeutic strategies. The broader implications of ECT in neurostimulation is that ECT's legacy extends beyond its direct applications, even though those are still very important today. ECT demonstrated that electrical stimulation of the brain could produce profound therapeutic effects, inspiring the development of these other neuromodulation technologies. What about transcranial magnetic stimulation? Introduced in the 1980s, TMS uses magnetic fields to induce electrical currents in the brain. It offers spatial precision in targeting underlying brain regions without requiring surgery or any other kind of invasive technique. It seems to have found a middle ground between ECT and tDCS in many respects. tDCS, on the other hand, has emerged as a simpler, more portable method for modulating brain activity, with clinical applications ranging from treatment of chronic pain conditions like fibromyalgia and migraine headaches, to improving depression symptoms, to improving motor function in stroke patients, as well as improving cognition in certain settings. The modern era of tDCS began around the year 2000, driven by increased understanding of neuroplasticity and cortical excitability. Researchers discovered that weak direct currents could safely and effectively modulate neuronal activity. This led to the standardization of tDCS parameters, such as using currents between 1 and 2 milliamps and treatment session durations of between 20 to 30 minutes. Seminal studies in human neurophysiology established tDCS as a reproducible and scientifically robust technique. These studies demonstrated its ability to influence cortical excitability and modulate behavioral, cognitive, and emotional outcomes. The simplicity of tDCS, requiring minimal equipment and offering versatility, positioned it as a cornerstone of non-invasive brain stimulation. Building on the success of conventional tDCS, innovations like high-definition tDCS have emerged. These techniques use smaller, gel-based electrodes to provide more precise stimulation of cortical regions. HD tDCS, or high-definition tDCS, offers potential advantages in targeting specific brain regions for therapeutic or research purposes. Remote supervised tDCS has also gained traction, enabling patients to receive treatment at home under clinical guidance. This particular development reflects the growing demand for scalable, accessible neurostimulation techniques. Today, tDCS is recognized as a safe, effective tool in both research and clinical applications. Its ability to modulate brain plasticity has made it a valuable approach in treating conditions such as depression, chronic pain syndromes like fibromyalgia and migraine headaches, and in rehabilitation and cognitive enhancement. The field continues to evolve with ongoing research aimed at refining stimulation parameters, improving brain targeting, and expanding clinical applications. During a tDCS session, electrodes placed on the scalp deliver a small electrical current that flows between an anode electrode and a cathode electrode. The polarity of the electrodes determines the effect on neuronal excitability in the underlying brain tissue. Anodal stimulation increases neuronal excitability, while cathodal stimulation decreases it. The simplicity of tDCS, combined with its ability to produce both short-term and long-lasting effects, makes it a versatile tool for both research and clinical applications. Its primary use includes modulating cognitive function, enhancing rehabilitation outcomes in conditions such as stroke, and alleviating symptoms of psychiatric and neurological disorders, in addition to certain chronic pain syndromes like fibromyalgia and migraine headaches. So how does tDCS work? The basic principle involves delivering a small constant current, typically between 1 and 2 milliamperes, across the scalp using electrodes. The current subtly alters the membrane potential of neurons in the targeted brain region, thereby modulating their excitability. The tDCS effects are polarity dependent. What does that mean? Well, each electrode has different polarity. There's a so-called anode electrode and a cathode electrode. The anode stimulation tends to depolarize neurons, bringing them closer to the threshold for firing, or helping them to become more excitable is a good way of thinking about it. While cathodal stimulation tends to hyperpolarize them, making it more difficult for them to fire, or suppressing activity. These effects can influence things like cognitive processes, motor function, and emotional regulation, depending on the exact brain region that's being targeted. One key advantage is that tDCS doesn't directly cause neuronal firing. Instead, it creates a conducive environment for plasticity, making it a gentle yet effective method for neuromodulation. To better understand tDCS, let's compare it with other neurostimulation techniques. How about transcranial magnetic stimulation, or TMS? Well, TMS uses magnetic fields to induce electrical currents in the brain. It offers precise targeting of underlying brain regions, but it requires more bulky and expensive equipment. In contrast, tDCS is more portable, affordable, and easier to administer. Another comparison we should touch on is with transcutaneous electrical nerve stimulation, or TENS, sometimes simply referred to as TENS. This targets peripheral nerves rather than the brain. TENS or TENS is important in applications such as management of pain and in physiotherapy, with electrodes applied on various parts of the body to stimulate the underlying peripheral nerves. tDCS's ability to target specific cortical areas in the brain makes it uniquely suited for cognitive, behavioral, and emotional applications. We should also mention tACS, which stands for Transcranial Alternating Current Stimulation, which is not available for clinical use. It's another type of an approach for non-invasive neurostimulation that's used in research settings. And there are even other things like transcranial random noise stimulation, or tRNS, again, in research settings, not for clinical use. These basically use different current waveforms of the electrical stimulation to achieve distinct effects in the underlying neurological tissue. Ultimately, each of these techniques has its own strengths and weaknesses, but the simplicity and versatility of tDCS gives it an edge in many clinical scenarios. The applications of tDCS are as diverse as they are promising. In mental health, tDCS is increasingly used to treat conditions like depression, anxiety, and post-traumatic stress disorder. In chronic pain conditions such as fibromyalgia and migraine headaches, it has shown efficacy in reducing symptoms and improving outcomes. tDCS is also increasingly understood to have a role in enhancing motor function after stroke and possibly also helping to address cognitive decline in neurodegenerative disorders like Alzheimer's disease. Beyond its clinical use, tDCS is also gaining attention for cognitive enhancement in individuals who don't necessarily have cognitive disorders. Studies have shown improvements in memory, attention, and learning when tDCS is paired with specific tasks. In the podcast, we'll continue to look at breakthrough research on tDCS in specific applications such as cognitive enhancement. This opens up the possibilities for various applications in education, sports, and even the arts. Of course, this also opens up important ethical considerations, which we'll discuss later in the course and which we discuss in other podcast episodes that consider the potential application for neurostimulation to improve cognitive function in people who do not necessarily have cognitive disorders. Overall, the versatility of tDCS underscores its potential as a tool for improving quality of life in various domains. So let's talk a bit about the current applications of tDCS. First of all, let's talk about pain management. So right now, the specific device, for example, that we use at ZipStim Neurostimulation is a device that's produced by a company called Soterix Medical in the States, and it has Health Canada approval for treatment of fibromyalgia and migraine headaches. So chronic pain conditions like this can be improved with transcranial direct current stimulation, and there's significant evidence base supporting that. In terms of mental health applications, depression, anxiety, PTSD. In Canada, at least, these treatments are off-label for the time being, but there's a growing evidence base that will likely have these being included in the approved Health Canada indications for tDCS in the not too distant future. In general also, again, off-label, in Canada at least, there's an exciting potential for tDCS to be helpful for people in various different kinds of conditions, such as stroke rehabilitation, in motor function recovery, and other aspects of musculoskeletal and neurological rehabilitation, as well as emerging areas. Again, now this is more in the research realm as opposed to clinically relevant at present, but the hope will be that as this type of technology is researched more and more, the clinical applications will grow as the evidence base becomes more robust for various types of conditions. In terms of emerging areas that are more for future consideration, but that are being heavily researched at present, it's exciting to think about how tDCS might be part of a strategy to improve cognition in people as they age, to help reduce the risk for things like neurodegenerative diseases, or perhaps even serve as a treatment for people who are suffering from neurodegenerative diseases. And overall, again, how might these technologies fit into a package of different kinds of tools to help people deal with various kinds of neurological and neuropsychiatric and cognitive disorders in a way that really allows their management plan to be personalized and tailored specifically for their particular needs. I think that with the fields coalescing and converging in terms of things like a better understanding of our own genetics and family history and our own specific risk factors for various problems, I think it'll be important to have neurostimulation techniques as part of the toolkit that we can discuss with our own healthcare practitioners in order to be able to choose the best tools that work the best for us to give us the best outcomes with the lowest risk of side effects, whether that's neurostimulation techniques, whether that's psychotherapy, whether that's medication, or a combination of all of those things. So the key takeaways that I would like to leave you with before we wrap up today is that transcranial direct current stimulation is a versatile, cost-effective, and safe neurostimulation technique. Its simplicity and wide-ranging applications make it a valuable tool for clinicians and researchers. And so understanding the basics of tDCS is essential for applying it effectively in practice. So as we've been discussing this, I've been showing you some slides as well that I've made based on the content here that we've been discussing, and I'm going to make those slides available to you free of charge. And there's been some images that I've shown of tDCS devices and the electrode setups, and we'll be discussing those in subsequent course lectures. And so again, if you are interested in that, please put comments or questions in the comment section, and I'd be happy to respond. And I hope again to stimulate discussion amongst viewers and listeners to really start to hopefully grow a community of people who are interested and want to share ideas and help one another learn about tDCS and neurostimulation in particular. As part of your interaction in the comment section, I would invite you to share which neurostimulation application are you most interested in, what kinds of results have you had in your research careers or your clinical careers with various types of neurostimulation options, likes, dislikes, what you see in terms of the future of where these technologies are headed, and what kinds of success stories that you've had, whether on-label or off-label. I would have to say that, in terms of off-label applications, of course, there's no formal recommendation here. This is intended for educational purposes only. But, it's something that, because we want to do the best that we can for our patients, and with their informed consent, we can sometimes go along with off-label recommendations that patients, again, with informed consent, have requested and want collaboration with as practitioners. And so I think part of our effort to do the best that we can for clients and patients who may be feeling as though the officially approved treatment options are fairly limited or not well tolerated or not fully effective, then really need to start thinking outside the box. And so it is the case often that these innovative technologies are often found to be quite useful and broadly applied off-label. And eventually the regulatory agencies, in a sense, catch up and then end up approving them so that they become on-label. But it's a complicated space and many different interests that are involved with all of these considerations. And so all of that's just to say that your interest and engagement in the educational piece is what I'm most interested in with this particular lecture and this course in general. And so I am very grateful for your interest and your time in watching and listening today. I'm also going to include in the show notes some resources for you, some links to sites that are important, I think, resource-wise in terms of enhancing your understanding about tDCS. So for today's lecture, it's an introductory lecture, and so it's going to be kind of a grouping of broad resources based on tDCS, the technology, and the history, as well as the clinical applications that we've been talking about. We're going to go into all of this in much more detail in future lectures as the course progresses. To summarize, today we've explored the basics of neurostimulation, and we've established tDCS as a non-invasive, cost-effective, and versatile technique for modulating brain function. Its simplicity and safety, coupled with a wide range of potential clinical applications, makes it a valuable tool for clinicians and researchers alike. In the next lecture of this course, we're going to dive deeper into the biophysical principles of transcranial direct current stimulation and learn about the factors that influence its effects. Thank you so much for listening or watching. I really appreciate your interest, your time, and your attention. I would really encourage you to like and subscribe so that you don't miss any future episodes. If you found this introductory lecture helpful, I would encourage you to stay tuned and participate in the full course on transcranial direct current stimulation. Also, if you think that this episode and the podcast in general might be interesting for somebody that you know, please forward the link to them so that they can appreciate and understand more about these revolutionary technologies also. I really want to encourage the construction of a healthy community interested in all aspects of neurostimulation in particular and neuroscience in general. This is part of my mission to provide education in neurostimulation and neuroscience to you free of charge every week. Don't forget to like and subscribe to the podcast. It's the best way for us to get this out to as many people as possible, and it's a great way to make sure that you never miss an upcoming episode. It helps us to reach more curious minds like yours. For more details about the research and technology we've discussed today, check out the links in the show notes below. You'll find everything that you need to dive deeper into this topic. And I'd love to hear your thoughts. Please join the conversation in the comments section or reach out to us on our social media outlets. Your questions, ideas, and feedback make this podcast much better. Finally, don't forget to tune into the next episode where we explore another fascinating topic in the field of neuroscience and clinical neurostimulation. We continue on in our course on transcranial direct current stimulation, and we have interesting and enlightening discussions with experts in the field of neuroscience, neurostimulation, health and wellness in order to optimize your own health and wellness and increase your understanding of these revolutionary neurological and neuroscientific techniques. Thanks again for listening. Take care, stay well, stay curious, and I'll see you next time on the Neurostimulation podcast.